Hi, Trish, my name's Aoife. I'm one of the nurses here in the dermatology department, and I'm going to be doing your procedure for you today, okay?
Yes.
So I'm just going to do the pre-operative checklist for you first, okay?
Yeah.
So can you confirm your full name and date of birth, please?
It's Trish Rochford.
Yeah.
That's 6475.
Perfect. And are you allergic to anything?
No, not that I know of.
Are you on any medication?
No,
Okay. And are you on any blood thinners like aspirin or warfarin?
no,
Nothing like that. And have you any diabetes?
no diabetes. No.
Have you had any transplants in the past?
No.
Are you on any oral steroids?
No,
Have you any infection risks like blood infections like hepatitis B, C or HIV?
no,
Any electronic devices in your body like a pacemaker?
no,
And is there any relevant medical history that we should be aware of?
no,
Nothing, no prone to fainting or anything like that?
no, not really. No.
Perfect. Okay, I'm just going to sign this here. Okay, so the next thing I'm going to do, Trish, is go through your consent for the procedure, okay?
Yeah.
You met the consultant in the clinic, and he's advised for us to take away one of your moles or lesions on your left arm. Is that
Yeah,
right?
that's right.
Can you show me which one?
Just there.
This
I
one
was
here.
just a little bit concerned about it.
Okay, so excision of lesion left forearm. Okay. So what we're going to do is, let's just say this is your lesion here. We're going to take a 2 millimeter margin of skin around that lesion, okay?
Yeah.
And then in order to close it, we're going to put little triangles here like this, so that we can close it in a line, okay?
Okay.
So it'll be a little bit longer than the lesion that's there at the moment.
Okay.
Is that okay?
Yeah.
In order to do this procedure, you need to have local anaesthetic. Have you had local before?
Yes.
Perfect, okay. So that just numbs up the area so that you don't feel anything sharp, okay?
Yeah.
There's a few risks associated with the procedure, and the first one is bleeding. So if there's any bleeding throughout the procedure, we'll look after it for you. But if there's any ooze on your dressing after the procedure, you just put some firm pressure on it for about 15 to 20 minutes and it'll stop. But we'll give you all that information afterwards as well. There's also a risk of infection, and there's 5% of a risk, okay, with any procedure, and you might get a wound infection. So the signs of that are redness, swelling, extra pain or discharge from the wound. And if that was to happen to your wound, you'd go to your GP for a course of antibiotics.
Okay. Yeah, that's fine.
The next thing is the scar I mentioned earlier, so a line like that, but sometimes there's also a risk of getting kind of a lumpy scar. We call it hypertrophic scar, and we don't know why this happens. Some patients just heal that way, okay? But you're at low risk because it's on your arm. Is that alright?
Oh, okay. Yeah.
And the last thing is, we advise patients no strenuous exercise, swimming or sports for about 3 weeks after the procedure, and that's to avoid your stitches bursting and your wound opening up, okay? That's called dehiscence.
Yeah.
If that was to happen, you can give us a call. We'll give you the numbers and contact us, okay?
I do a lot of swimming. Can I go back swimming?
So no swimming now for the next 3 weeks,
That's fine.
okay?
Yeah, that's no problem.
Is that alright? So have you any other questions?
No, so I won't be left much of a scar.
Just a little bit longer than the lesion that's there at the moment. So from about here, maybe here to here.
Okay.
Is that
yeah,
okay?
That's okay, yeah.
Okay, perfect. So I'll just sign here. And today is the 1st of September.
Yeah.
Perfect. So you just have to sign on the back for me, if that's okay, and date it.
Thank you.
Perfect. That's great. So the nurse will help you up onto the bed,
Okay.
and I'll just go and clean my hands, okay?
Lovely, thank you.